The Division of Unclaimed Funds is telling News 5 it's received more than 1 million claims in just the last year.
Yeah, that is doubled compared to the year before. News 5's Clay Lepard looks further into the wait and what's being done about it.
You're about to understand why we agreed to blur this woman's face and not share her real name. So we will call her Brooke.
I left Ohio under kind of personal pretenses for, a domestic situation. So I really didn't even want to be interviewed. I don't want people knowing who I am or where I am.
When she left Northeast Ohio several years ago, Brooke had no intention of looking back.
Don't want to cause more problems than I'm already dealing with.
Then Brooke learned she had unclaimed funds with the state.
You had no idea?
I had no idea.
Royalties from drilling on her Northeast Ohio property. Money that could turn things around as her family navigates medical bills piling up.
I mean, it would significantly help us try to climb out of the hole that we're pretty much in.
So in January of this year, she filed a claim for her lifeline sitting out there.
The money would definitely help, at least help us keep our house. I mean, that's the one thing that we haven't lost so far. We've lost everything else.
6 months later, and she's not even sure anyone at the Division of Unclaimed Funds has looked at her request for the nearly $500,000 she's owed. The Division of Unclaimed Funds told us on June 12th that they are still processing claims that were submitted in the second half of last year. So how many have they gone through? For perspective, in 2024, the division paid out 26,000 claims. In the year after the Browns announcement, they've paid out 187,000 claims.
We have made significant modifications to our website and the underlying technology that's behind the website.
Last September, we told you how the Division of Unclaimed Funds rolled out new technology, leading to much faster payouts for about 20% of the claims that come in.
The underlying technology is what's most critical because it allows the information that's been provided by the claimant to be autonomously validated so that we can more efficiently process that claim.
Autonomously validated.
Yes.
So in simpler terms, does that mean people, when they're filing their claim, are seeing that check in the mailbox quicker?
Exactly. Where in the past, all claims would get processed between, let's say, 90 to 100 days, right? Now, some people are getting their funds in 2 weeks.
Consider Mary Matusik and her $167 one of them.
There it is in the mailbox.
3 weeks from when?
3 weeks from start to finish.
That's fast.
For the government agency, yes, extremely fast.
While many like Mary saw their money quicker than ever before, News 5 is still receiving emails and calls from people waiting 6, 8, 10 months just to hear back on the status of their claims. A holding pattern for people like Brooke, waiting to move forward.
They need to do some thinking of how they can solve this and speed up the process because it's just taking way too long.
So what has Unclaimed Funds done to handle this backlog? Over the past year, the division increased their full-time staffers from 51 to 59 employees and are in the process of hiring 12 part-time staffers to handle claims. Katie?
They need to get those positions claimed. All right, Clay, thank you so much. And to be clear, the Browns have not received their $600 million in unclaimed funds from the state yet. A judge in Columbus blocked the state from taking ownership of roughly $1.7 billion to $1.9 billion in unclaimed funds while a lawsuit plays out.
Straight ahead on News 5, have you ever opened a medical bill and been confused by some of the costs? Well, there's a new law addressing that. One problem, though, many Ohioans say they're confused by the law as well. Investigator Jonathan Walsh tries to clear things up. Next.
You're watching News 5, part of the Scripps News Group.
Welcome back. Have you ever gotten a medical bill and you're like, the heck are these costs? You're certainly not alone.
But Ohio has a new law. All hospitals have to be transparent with their medical pricing, and the state's Department of Health has to enforce that law. News 5 investigator Jonathan Walsh has found that what that enforcement looks like so far. So, Jonathan, patients are contacting you, wondering about these bills.
Yeah, and trust us, we hear you. And guys, all of that is with Ohio's transparency law. There's confusion about what hospitals are following which standards. And we uncovered price transparency audits have not been across the board in Ohio each month. Did they ever tell you how much all this was going to cost?
No.
Tim Hardy from North Canton says he called ahead of time and talked to staff of Summa Health's Green Emergency Department about needing help with some stitches.
It was given nothing but the affirmative that, yeah, this was going to happen. We'll take care of it. We do it all the time, no problems.
But he says the doctor then told him he could not do anything for Tim. He then received a bill from Summa for $1,600 and another bill from the doctor's group.
The actual doctor, that was over $700.
So $2,300 bucks.
$2,300 for basically taking up space and having maybe 3 or 4 minutes of the doctor's time.
To say the least, Tim has been frustrated.
Any other good or service I buy, no matter how simple or complex, I have a very good understanding up front.
The Ohio Department of Health, or ODH, is responsible for enforcing the hospital price transparency law in 200-plus hospitals in the state, making sure, for example, health systems show prices for services in dollars and cents.
We can stabilize the cost of health care and hopefully someday drive it down because the transparency and the price is out there.
Ohio Representatives Tim Barhorst and Ron Ferguson are the architects of the law that went into effect last year. ODH's first enforcement list showed half a dozen medical facilities not in compliance. This month shows just one hospital in the state not complying. Is Representative Ferguson a bit skeptical about that?
People at the Ohio Department of Health probably aren't going to be as strict as consumers, actual Ohioans would be.
News 5 investigators were persistent with questions to ODH, which then admitted it does not audit every hospital each month. It just puts out a list as required. But since 2021, the feds have been leading the crackdowns on hospitals, including most recently involving hundreds of facilities.
This is the largest enforcement action we've seen to date by far.
Ilaria Santangelo is the director of research for PatientRightsAdvocate.org that's been tracking high rates of noncompliance from hospitals across the country for years now.
96% of Americans want price transparency. So the more monitoring, the more enforcement from Ohio or from the federal government, this is great for all American patients.
But there is a big difference at the heart of that enforcement. News 5 investigators combed through pages and pages of federal data and found CMS cited 19 different Ohio hospitals since January, while the most that ODH cited this year was 5, with each monthly list having the same hospitals, except one facility would basically come off the list every month, all showing the feds keeping its pulse on price transparency more. The American Hospital Association said this month improving price transparency is not working, calling the requirements on hospitals a significant administrative burden, and the complexity of health plans is much of the challenge to giving patients true prices. Meanwhile,
but in this case, it's just really sticking in my craw.
Tim tells us he got the doctor's $700 bill dropped. Summa apologized to Tim, cut its $1,600 bill in half, and said in part Tim was billed accordingly. Tim tells us more transparent details should be given to patients on their way out of appointments and procedures.
All the materials that were used, all the processes, tests, so you had an idea what you could expect coming in the mail.
The Ohio representatives tell us more enforcement and compliance are good, but they still want to add consumer protections for you so you can hold hospitals more accountable. They're going to take a look at that the next legislative session. ODH, CMS, Summa would not go on camera and answer our questions. You can read their full statements on our News 5 app.
All right, Jonathan, thank you so much. Okay, we change course here now and get back to weather because we're tracking some more health stuff.
Storms have been pushing through, proving to be severe in spots. Let's get right back to meteorologist Katie McGraw. She's been tracking all of this for us, both live on air and online too, Katie.
Yes, absolutely. So some of the changes that we've had in the last half hour or so, there is one tornado warning in Ohio. Actually, there's two, but close to our viewing area. If you have friends or family in Columbiana, this storm started in Stark County. That's where it really got its act together. Paris, if you have any damage, the storm has now, it would be safe to go out. Let us know if you saw anything, because that's when the rotation really started to tighten. As it moved into Columbiana County, that's when it got the tornado warning. Otherwise, all of these other beige boxes that we have here are strong storms. So even the severe thunderstorm warning that we had in Cuyahoga County, as it continued to progress into Geauga, and it's going to slide probably in between Parkman and Nelson in the next 10 minutes or so. This storm at one point was dropping some pretty large hail. We've gotten some decent pictures of hail that has dropped across the area. That storm was most impressive because of the hail core that was on it. But all of these storms, multiple threats, with the heavy rain, blinding rainfall across some of our major interstates here this afternoon and evening. Also frequent lightning just within this one little storm here as it passes from South Russell into southern Geauga County. As I mentioned, it's going to continue to push towards Parkman and Nelson, and there is still some hail falling out of that storm, but also some gusty winds. And there is that then severe thunderstorm watch in effect for Lake County, Ashtabula, Geauga, Portage, Trumbull, Stark, Tuscarawas, and Carroll County until 1 a.m. I do not believe that the storms will be severe until 1 a.m. I think that this is going to be for the next couple of hours, probably. So we're sitting at 6:19. I would say pessimistically 10 o'clock. On the more optimistic side, maybe 8:30 that we see the worst of these storms start to fade away. So we are live, as you guys mentioned. We're streaming on Facebook and on YouTube. So because we don't have tornado warnings, because we don't even have any severe thunderstorm warnings, we're going to keep watching the storms in that regard. Now, in the meantime, we do still have a couple